Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist because in the playlist I have provided almost all the topics so far we have discussed in a very systematic order. It is quite convenient for the study when you start reading. Thank you very much. So, my dear friends, you know that we were discussing about clinical understanding of doshas in day-to-day practice. So, in that series, almost all we have covered more than 18 parts. So, today we will have the continued portion of the same. In the last class, we are discussing about the clinical application of these rasas and as well as its effects on the doshas when we are doing the treatment. So continuing the same, today we will see the use of rasa in the treatment of the doshas. So today we will take an example of one of the most commonly used yoga in our practice, that is Shadanga paneeya. Okay, Shadanga paneeya has been indicated most commonly in case of fever. So whenever there is daha etc. is there. Now similarly, the Shadanga paneeya is used to actually attain the jwarahara property, and we know that the Shadanga paneeya is used to attain the jwarahara property. But this Shadanga paneeya also contains one drug which is called as Nagara. Okay. Now, if you go back, if you look into the classics, the Shadanga paneeya is basically explained in case of Pittaja Jwara. Although it is used in all the Jwaras, but basically it is explained as a treatment for Pittaja Jwara where Daha is more. So, if you look into the combination of Shadanga paneeya, so there are so many Tikta Rasa Dravyas are there, so many Kashaya Rasa Dravyas are there, which are basically Pitta Hara in nature. So we have got Kashaya Rasa drugs also, and we have got Tikta Rasa drug also. So basically they are Pitta in nature, therefore it is good in Shadanga paneeya. But there is one drug, for example Nagara, as I explained earlier. The Shunti or Nagara, basically Shunti or Nagara is not a Tikta Rasa. Okay. So to some extent you can consider it as Katu Rasa because it is having Katu Rasa, and it is also a little Tikshna in Guna, and most of the gunas of Nagara, okay, or Shunti, which is there, so they are a little bit opposite to Pitta, and it instead of Pitta Hara it may lead to Pitta Vriddhi, okay, to some extent. So and further, so if you give, when we know that the Nagara is there, which is basically having Tikshna Guna and Katurasa also, it is included in Shadanga paneeya, which is considered to be a Pitta Hara, okay, and indicated in Pitta Jwara. And because of Nagara, basically there would have been what you say aggravation of the Pitta because of its Tikshna Guna. But it will not happen so, because the rest of the drugs which are present there, rest of the dravyas which are present there, for example Musta, there is Chandana, there is Ushira, etc. So they are basically Tikta Rasa and Kashaya Rasa drugs, and also the Haprashamana drug, and they may cause increase in the kapha. Okay, so basically they are Shita Guna drugs, like Ushira is there, Chandana is there, Musta is there. So they are Tikta Rasa drugs and Kashaya Rasa drugs, and as a result the Shita Guna can increase, and as a result Kapha can increase, and even because of this Vayu can also increase to some extent, because the Shita Guna is also present in Vayu. So Kapha and Vayu can increase because of this. Okay, so therefore there may be Kapha Vriddhi and there may be also Vata Vriddhi possible. So to counteract this particular possibility of Kapha Vriddhi and as well as Vata Vriddhi, because of the Shita Dravyas which are used in the combination of Shadanga paneeya, there is also a one drug added, Nagara, which is having Katu Rasa and Tikshna Guna. So hence a drug which is Kafahara and also the Vatahara with the Deepana property like Shunti or Nagara has been added in Shadanga paneeya. So this is how a yoga is formed, by keeping in view of a dosha analysis. Okay, so further Shunti is also Amapachaka, which is very much important for us in case of Jwara, because Jwara is basically because of Ama. So further Shunti is also Amapachaka, hence it can be given in all the types of the Jwaras. So and all the Jwara is basically due to Ama, we know that. So even in Navajwara, to pacify, even Shadanga paneeya is even given in case of Navajwara to pacify the Daha, Osha, etc. So even in Navajwara also this can be given. So this is the beauty of Shadanga paneeya. So we need to analyze each and every drug and its related dosha analysis, because none of the yogas are randomly formulated. So they are formulated by keeping many things. So one of the example is that of Shadanga paneeya. So this is all for today. In the next class, we will discuss about another important topic related to dosha analysis. Thank you very much. Please do subscribe to my channel and also please give your valuable comments. Thank you very much.